Good afternoon. This is a case report. Moxifloxacin induced corneal toxicity, a case report. 58-year male presented with defective vision and progressive whitish discoloration in left eye for since 2 weeks, increasing the severity from the past 3 days. Not associated with pain or redness. No history of headache or photophobia. No history of diplopia, floater and flashes. Patient underwent left eye cataract surgery 4 weeks back. Did not follow up after post-operative review. He was prescribed topical dexamethasone, moxifloxacin combination 2 hourly and calcium chloride, potassium iodide and sodium chloride in combination as eye drops for 1 month. Vision, right eye was normal. Left eye vision post-op 3, 6.9 with pinhole 6.6. But when you come for follow-up after 1 month, around 31 days, it becomes hand movements. When you examine this patient, there is, you can see, there is crystalline, whitish crystalline deposits in the epithelium and up to mid-stromal lesion. And there is, when you do staining, there is fluorescent staining is taking place around 7 millimeters. When you do when you have done the investigation, serum calcium, potassium normal, corneal scraping done for KOH and gram stain, it's become negative. This we clinically diagnosed as a moxifloxacin induced keratopathy. Management, what we have done is stop the moxifloxacin eye drops and started lubricating drops and tobramycin eye drops, and therapeutic scraping was unsuccessful. Status quo we maintained for 2 months for follow-up, but there is no improvement in this patient. Then later planned penetrating keratoplasty. Patient underwent keratoplasty, but we didn't send for corneal button biopsy. Fluoroquinolones are bactericidal broad-spectrum antibiotics that inhibit bacterial genetic replication through DNA gyrase and topoisomerase. Medication-induced corneal deposits have been reported with topical ciprofloxacin, ofloxacin, norfloxacin, porfloxacin, gatifloxacin, tosufloxacin, but very rarely reported. Only one case is reported with moxifloxacin. That too, after stopping the drops, that crystalline deposits are subsided. But in our case, it's become irreversible. That mechanism may be, this is some factors which linked, there is unchanged in the pH level and tear film, corneal edema with impairment of corneal epithelialization and multiple drugs. Deposits can be confirmed by corneal biopsy. Topical steroid can cause corneal deposit, and corneal deposit can confirm by light microscopy with 1 COSA stain, electron microscopy intracellular deposits, X-ray with energy dissipative particles. These deposits usually resolve with the cessation of drug. Conclusion, patient started on topical drugs should be on close follow-up, especially antibiotics like fluoroquinolones. Early recognition of these deposits, cessation of drug might resolve the deposits. Here the patient came late. Maybe that is why it's become permanent. Epithelial defect was there, and these deposits are like in epithelium up to mid-stromal lesion. Whatever previous reported in fluoroquinolones, they stop the drops, whatever medications, it is resolved. And it has become almost, it's normal, very few cases. But moxifloxacin is only, this is second reported case. And it has become irreversible damage. Thank you.
So no biopsy you said was taken
finally biopsy
was not taken?
Not taken. Usually this is clinical diagnosis.
No, agreed. But what will help in the future? It may
help that is what missed, madam. That's okay. Okay, that is what missed in this case. That.
And plus, it was a combination drug, so there will be some preservatives also. So it was not purely using moxifloxacin. I was more interested in the biopsy for that reason.
That is
not just pathological, but biochemical biopsy.
What happened is, madam, that went for other hospital. They have done the keratoplasty. They didn't send for. Later, came to know that. They didn't send for biopsy. That is what become problem for this patient.
So the patient was on steroid,
yes,
moxifloxacin, and everything.
Yeah.
So how
This is maybe tear film. Most of the time, previous reported cases, fluoroquinolones can cause corneal deposits, but moxifloxacin is not reported. Gatifloxacin and ciprofloxacin cases reported previously.
What was the dose? Because we usually
second hourly, 6 times a day. Yeah. And he didn't come for follow-up. First follow-up is finished. After next follow-up, patient came after 1 month when the vision is dropped. When first follow-up, vision was 6.9 with 6.6. When he came for after 1 month, when hand movements, okay, then only the patient came to follow-up.
So was he using moxifloxacin for 1 month?
No, that patient Usually second follow-up, after 2 weeks we'll stop it. But patient didn't turn up for follow-up.